Hello everyone, today we are going to start our new series, that is Fmge question and answer revision series. Okay, so these topics are very important topics which are going to take according to the questions. Okay, these questions have been asked in the previous examinations. Because these topics are repeatedly asked, so I have tried to cover these topics in relation with the questions. Okay, so coming on the first question, that is which vaccine is given at the birth. Okay, so BCG, OPV, hepatitis B, these all three, option A is given at the birth. Okay, so as per the question, our immunization schedule is very important, that is national immunization schedule. Okay, national immunization schedule. Okay, so BCG, OPV and hepatitis B is given. BCG is given 0.05 ml at birth. OPV, 2 drops of OPV, 0 dose. It is also called as 0 dose of OPV at birth and up to 14 days. Okay, 14 days, or you can say that 2 weeks. Okay, hepatitis B, 24 hour, first 24 hour. Okay, it is called birth dose of hepatitis B. Okay, as you see the immunization schedule, this is the immunization schedule latest. At birth, BCG is given, okay, OPV is given 0 dose and hepatitis B birth dose. BCG is given intradermally, OPV oral and hepatitis B is intramuscular. Okay, intramuscular dose is most often given at anterior lateral aspect of thigh and mid thigh. Okay, मिड थाई में हम देते हैं. ठीक है. आफ्टर दैट एट 6 वीक OPV फर्स्ट डोज इज गिवन. पेंटावेलेंट इज गिवन. पेंटावेलेंट contains DPT, diphtheria pertussis tetanus, as well as Haemophilus influenza B and hepatitis B. So these 5 vaccines are given in pentavalent. Okay, and rotavirus vaccine first dose at 6 week, because in the later phase of life, if it is given after the 6 month or up to the 8 month to 9 month, intussusception can occur. Then fractional IPV is given. Injectable polio vaccine is started now. Fractional dose intramuscular. Usually IPV is given intramuscular, but fractional dose is given intradermally. Okay, fractional dose is given is intradermally. IPV is earlier given as intramuscularly, but not fractional dose is given as intradermally. Okay, intradermal has 2 vaccines, that BCG and IPV. Okay, fractional IPV, not IPV. And pneumococcal conjugate vaccine is given, PCV, first dose at 6 week. It is also given intramuscular. So intramuscular dose given as anterolateral aspect of thigh, intradermally in the BCG as usually left arm. Okay, at 10 week OPV second dose, pentavalent second dose and rotavirus second dose. Rotavirus is oral dose. Okay, 5 drops is given. रोटावायरस की कितनी डोज होती है? 5 drops oral. At 14 weeks, this 1 month gap is there in the all 3 doses. OPV 2, OPV 3, pentavalent 2, pentavalent 3, rotavirus 2, rotavirus 3. Okay, and after PCV at 6 week and 14 weeks, PCV booster is given at 9 months. Okay, so PCV is given like that, 6, 14 and booster. OPV is given 1, 2, 3 at 1 month interval. Pentavalent 1, 2, 3 1 month interval. Rotavirus 1, 2, 3 1 month interval. Fractional IPV at 6 and 14 only. Okay, intradermally. And at 9 to 12 month BCG and measles, measles and rubella first dose, and at 16 to 24 month measles second dose. Okay, MR2, MR1 here, MR2 here. Okay, Japanese encephalitis first dose is given, measles is given subcutaneously, Japanese encephalitis also given subcutaneously, measles and rubella given at right arm, and Japanese encephalitis given at left arm. Okay, these are subcutaneous vaccines. Then after at 6 booster dose of DPT is given, booster 1 and booster 2 at 5 to 6 year DPT booster. Okay, OPV booster is also given as 6 to 24 months. So up to 1 year, if all the vaccines are given, and from these 16 to after the 12 months, these booster doses are there. Okay, so that's why whenever the child has immunized up to 1 year, we can say that it is completely immunized, and after that booster dose is given. At 10 year, earlier TTs was given, now tetanus and diphtheria, this is given TD, small dose of diphtheria, not equivalent dose like this, that's why it is written in the small letters. Okay, so it is called tetanus diphtheria toxoid. Okay, at 16 year TD is given. In pregnancy, earlier TT was given, now TD is given, diphtheria. Okay, this small dose of diphtheria is added. Okay, TD1 and TD2. Okay, and when the pregnancy is within 3 years, so only one dose is given, that is called as TD booster. Okay, so that completes the immunization schedule. So whenever it is asked, sometime it has been asked that measles has been given at the 5 months, usually not measles not given at 5 months. Okay, but if it is written and you have been asked that what second dose should be given, so second dose should be given at 9 months. Okay, but usually in the schedule it is given at 9 months, and after that it is given at 16 to 24 months. Measles alone earlier was given, now measles rubella combination is given. Okay, so coming on the second question, that is sputum, TB sputum examination comes under. So this is a level of preventions. Level of preventions are very important topic, frequently asked in the Fmge. Okay, so sputum examination comes under. So sputum examination is done for the diagnosis of the TB. Okay, AFB staining is given so that acid fast bacilli can be easily seen under the LED microscopy. So it is part of early diagnosis. So diagnostic part is in the secondary prevention. Okay, so here answer should be secondary prevention. Okay, so level of prevention is very important topic, so we have to look at the level of prevention. What are primordial prevention? Primordial actually early in the life, and this prevention it is usually before the emergence of the risk factor. This is the important line which you have to remember and to differentiate between the primary and primordial, because here risk factor has been there. For example, a child at the childbirth, from the birth you are telling him to not to smoke. Okay, if you are telling him not to smoke, already there is no risk factor for a child who is 3 years or 4 year old, because he will not smoke because he is away from the risk factor. But from the earlier life, if you are instill this health promotion in the brain of the child, so that he will not smoke in the later life, so that is kind of a level is primordial level. Okay, and if an adult college going student is smoking already, and you have to stop the smoking so that coronary artery disease and lung cancer cannot develop, so this kind of prevention will be primary prevention, because risk factor is there and he is smoking. So you have stopped the trying to stop his smoking. So this is the level of prevention is called primary level of prevention. Okay, so primordial is inhibition before the emergence of risk factor, primary is after the emergence of factor. There specific protection is also there. some words are specific protection, wherever it is specific protection, that is the prevention is primary. Okay. For example, chemoprophylaxis, for example, immunization, these are specific protections. So whenever it is there, that is a primary level of prevention. In the secondary prevention, early diagnosis and treatment. The early diagnosis and prompt intervention, wherever it is there, then it is secondary prevention. And the tertiary prevention, it is done for the reducing the long term disease, disability and to rehabilitation. Okay, that is a tertiary level of prevention. Okay. So coming on our question, so this is the early diagnosis part. So it is secondary level of prevention. Okay. There are some few related questions can be asked. For example, most of the government programs have, as you know, that government programs contains all primary, secondary, tertiary, all level of preventions. But most commonly government programs are meant for the secondary level of prevention, to treat. Okay. Most of the government program comes on secondary level of prevention, but program contains all the primary part as well, health promotion, health education as well, specific protection as well, and tertiary part as well to reduce the complication, but major part is the treatment part. Okay. Patient with more than 2 weeks of cough at DOTS clinic. So if he is coughing, you have to sputum examination. It is a early diagnosis and treatment, that is secondary level of prevention. If class 5 child is discouraged for adopting bad lifestyle, so 5-year child very early in their life, before the emergence of risk factor, that is primordial. Okay. Primordial level of prevention. Spectacles in visual impairment, visual impairment is actually a disability. Okay. It is a catch question, although it is very easy to wear specs, but it is a tertiary level of prevention because it helps in the reduction of disability. Okay. It is tertiary level of prevention. Okay. Chemoprophylaxis of the meningococcal meningitis. So any chemoprophylaxis or immunization is a specific protection, and specific protection is a part of primary level of prevention. Okay. So primary level of prevention is there. Okay. Immunization of disease, immunization is also a specific protection, it is primary level of prevention. Okay. Screening is done for the early diagnosis. It is healthy community, but is apparently healthy. Many of the people have diabetes and they appear to be healthy. Okay, apparently healthy. So screening is done to select out the cases. So to select out the cases, that is early diagnosis. Early diagnosis is part of secondary prevention. Okay. Sleeping in the bed net. Bed net is for specific protection for the mosquito. So specific protection is the part of primary level of prevention. So there are some words, catchy words, which you have to remember. Early diagnosis treatment, secondary prevention, specific protection, health education, primary level of prevention. Health education is very early of the life, that is primordial level. Okay. Crutches in polio. Crutches, if anyone has a polio, that is disease has already been occurred, you do not able to stop the disease, but you are able to rehabilitate that person by the crutches. So it is rehabilitation part, it is a tertiary level. Okay. Disability limitation, rehabilitation is the part of a tertiary level of prevention. Tertiary level of prevention is disability limitation and rehabilitation. Okay. Okay. Now coming to our next question, that is see the image and identify. So this image is shown here, birth and deaths per 1000 per year. For every graph you have to see clearly. Okay. That is the y-axis, that is the x-axis. In the x-axis there are stages: high stationary, early expanding, late expanding, low stationary. These are stages of demographic cycle, and this is birth and death per 1000 per year. Birth rate, death rate is higher, and birth rate is gradually declining. Birth rate is declining and stable now, and death rate is the death rate, that is declining, and it is stable down right here. Okay. Population is stabilized here. Population is growth, then is here is stabilization population. Okay. Low stationary means low birth rate, low death rate, stable population. Okay, here high death rate, high birth rate, ठीक है, but population is not growing because both are high, but as the birth rate is not increasing but death rate is decreasing as the country develops, usually it happens population growth, early expanding, then late expanding, then stationary. Okay, so our country is here late expanding phase. Okay, death rate is declined but birth rate is not up to the mark, declined. Okay, so but in future up to the 2045 our target is to achieve stable population. So this is the kind of a changes in the population. It is called as demographic transition from high birth rate, high death rate to low birth rate, low death rate. It is a kind of a demographic transition from the underdeveloped country to the developed nation. This is the transition and it is known as demographic transition. That will be the answer. Okay, you have to understand the demographic cycle. It is a population cycle, but here it is showing the transition phase. Okay, that's why it is called as demographic transition. Okay, now on the WHO day there are 4 to 8 persons sitting in front of an audience. A table is there, 4 to 8 persons are sitting around the table, audience is here. Okay, audience sitting here and experts are discussing any topic in between. Okay, so audience are listening what experts are discussing. So it is a kind of a panel discussion, kind of a health education promotion. So you have to learn what are the health communication part. This is what is this spike, what is this symposium, what is FGD. So coming health communication methods, that lecture method all know that chalk and talk method, usually 30 less than 30 group, 15-20 minutes lectures are there. Larger audience in the small time can be covered, but in the lecture method usually it is a passive learning. Teacher speaks, student listens usually, and usually there are no question answer session. Nowadays competency based assessments are there. They are trying to do more interactive lectures so that you can ask question as well. Okay, but earlier the true lecture method is passive learning. Okay, what is FGD? That is focus group discussion. What is FGD? FGD is a focus group discussion. Okay, this focus group discussion is very effective method. It is discussed among 6 to 12 person. It contains a facilitator and a recorder is there and a diagram is made. It's called sociogram. It is a two-way process. No audience there. All are around sitting in the round table. All are discussion in the same topic. Like that, family members of the one family here, all the representative of the families are there. Any agenda is there. Any topic is there. For the example, breastfeeding is discussed among these family members or these persons, and one is a facilitator here who is trying to facilitate this talk. These lines are there, which kind of these are communicating with this, he is communicating with this, he is communication with this. This means there are so many lines are there, so many people are talking in between. Okay, but one time only one will speak, other will listen, so that many of the new topics, new scenes which are not known to earlier peoples now can know. Okay, so this kind of group discussion is called a focus group discussion. In 6 to 12 persons are there. Any topic is discussed in between them and consensus. Now coming on panel discussion. This was our question. 40 expert member in front of the audience. No set out of speech, because there is no set of order basis. People are, number 1 is talking to after number 2 and number 3 and number 4. There is no sequence. Okay, anyone can ask question in between, and these are experts. Okay, in focus group discussion, these are normal people, not experts. Okay, Now coming to workshop. Workshop is series of 4 meetings. Major purpose is to impart practical skill, training and participant, group work, group discussion, plan of action, resource panel, resource personnel and consultant. Usually workshops are done to impart skills to the participants. Symposium. Symposium is a series of lectures by the experts. A podium is there. One speaker comes, talk. Next speaker comes, talks. Next speaker comes, talks. So this kind of series of speeches is called symposium. If these are talking in between, so it is a panel discussion. But in the symposium, there is no discussion between the experts. Okay, this is a difference from the panel discussion. Role play or social drama. We all know that street plays are there. So this social drama or role plays is a part of a health communication. Okay, this is a diagram of the workshop. Training, goal, idea, skills are developed in the team. Okay. Conference. These are combination methods. Maybe symposium, maybe panel discussions are there, and maybe question answer sessions is there. There may be workshop is also included in the conference. So this is a combination method of at a huge level. Okay. So all type of communication can be there. Okay. Interpersonal communication, it is a face-to-face communication. It is the most effective communication. Okay. When we talk to the face-to-face anyone, so this is the best kind of knowledge installation as compared to the group. Okay. After that, focus group discussion is also good, because here a closed audience is there which is interactive in nature and interacting in between, so that many topics can be discussed. Okay. And a facilitator is there, and group leader and recorder is there, so that nothing can be missed by the recorders. Okay. Demonstration. Demonstration is, you can see that ORS making, for example, ORS making. You go to the village and teach people to people how to make ORS. So people are seeing that, and they also give an ORS packet, so they do by the learning, and they believe that now I can also make ORS well. Okay. Flannel graph, it is a photograph pasted on the cloth. Some photographs are posted in the sequence manner, so that in the diagrammatic manner you can understand from the hand washing methods. Okay. See the photograph in the hand washing. By the flannel graph you can understand how to wash the hands. This is spikes. Spikes is as for setting, P for perception, I for invitation, K for knowledge, E for emotion, S for summary. So these spikes is done to advanced career planning conversations. Which kind of person that we have talk in spikes? Actually it is started for cancer patients. When we disclose that your family member has a cancer or you have a cancer, so we have to be very empathetic. Okay. We have to respect the feeling of the patient. So in that thing we have to choose a private place, that is setting. Okay. Patient should be comfortable, or his attendant should be comfortable. It should be non-threatening. He should not be threatened that you have been in the very closed space. Okay. So you have to uncover the what patient think, a family thinks about what is happening. You have to ask, what do you feel that your patient is recovering or not? Okay. Then we have asked patient what they would like to know. Okay. Then we give the knowledge part. Okay. That what is happening your patient, this is suffering from cancer, there will be less chances or more chances, or second stage or advanced stage. Okay. The patient will attendant patient will react. So we have to respect his feelings, we have to respond with empathy, and we have to summarize that what our next plan, what we can do in this manner. Okay, in this case. So these spikes is for usually done for cancer patients or any approach to advanced care planning conversations. Okay. Whenever we have to more empathetic and more focused on any conversation with the patient, so we have to approach like that. Okay. Another approach is the gather approach. It is called counseling method for the contraceptive counseling. Earlier cafeteria approach was there. Now gather approach, G for greet, A for ask, T for tell, H for help, X for explain, and F for return. So first of all, when you have to counsel any patient for the contraceptive counseling, so we have to greet him or her. Okay, we have to greet him, then ask what is their requirement, then tell what they have options, then help to choose them what kind of contraception they have to they are that are good for you. Okay, we have to explain the risks and benefits of taking, and we have to ask them to return or refollow. Okay. Now there is a Delphi method. In the Delphi method is a systematic interactive forecasting method, so that there are few experts which are living in Canada, one expert is living in the US, one expert living in the India, one expert living in the Australia. These all are experts are there, and these experts are sending, we are sending a similar kind of problem is there. They give the solution, they give they give the expert advice. These advices are collected, and these advices are collected, and common consensus is made, and these are again posted to them. The other speaker has said that, other experts have said that, so they recorrect themselves, and they come to a common consensus. A common consensus has been made between the experts. This kind of method is called Delphi methods. Okay. So it is a reliable and creative exploration of ideas or the production of suitable information for the decision making. So any decision making, you have to talk to all the experts and you told all the experts that what other expert thinks. So a common consensus has been made. Okay, that is called Delphi method. It is usually done, for example, any questionnaire is developed, any research method is developed, and these questions are right. So you have to send all the experts to the questionnaires, so the common questionnaire can be made by their inputs. Okay. Now coming to the next question, that is person in an industry lost his hand. Okay, this is also a very important topic. Okay, this repeatedly asked in your Fmge examinations as well as Neetpg as well. Okay, the person is in an instant, he lost his hand, he is unable to do his daily activities including machine work, which is an impairment in the guy. So this is what has been asked here, impairment. Okay, there is accident, there is impairment, disability, okay, handicap. Okay. So what is the impairment here? Impairment is if he not able to do work, is disability. Loss of anatomical structure is impairment. Okay, this is the answer. This is the topic you have to know. Okay, you have to understand this topic. Any disease, an abnormal condition or accident is the first part. Impairment is a loss of foot, anatomical, physiological, any psychological disturbance is impairment. Disability is unable to perform any activity, is unable to work, for example, unable to work. Handicap is a disadvantages given individual resulting in the unemployment, loss of job. Okay, so here unemployment is a what kind of this? This is handicap. Okay, anatomical structure, impairment. Question is impairment. So answer should be C. Okay. Disability limitation is a prevent transition of disease from impairment to handicap. So in the limitation, if your impairment is reduced, so you cannot be handicapped, it is called disability limitation. Okay, it is a kind of a tertiary level of prevention, and rehabilitation is a tertiary level of prevention. Here handicapped persons are trained and retrained so that highest possible level of functional ability can be given. You have seen that many of person loss of foot is there, but by the blades, by the steel blades they are wearing and they are running. This is kind of training is a functional ability training, is a part of a rehabilitation. Now couple goes to hospital and told doctor that they are prone to have anencephaly in their baby. Okay, anencephaly, you know that anencephaly, what is anencephaly? The brain is without any cranium. Okay, the brain is there but there is no cranium is there, so there is kind of a neural tube defect. Okay, so what is the government program to reduce the neural tube defect? That is folic acid supplementation, and usually neural tube form before the patient knows, before the missed period, amenorrhea, neural tube is already formed. So, you have to plan your pregnancy to prevent this. Plan the pregnancy. So, it should be given periconceptionally. Okay, this should be the answer. Means before the conception. Many things in India happens accidentally. For example, pregnancy, but pregnancy should be planned. Like wedding. Wedding is planned very well planned. No? Wedding is very well planned, but which kind of guests will be there, what kind of food will be there. But pregnancies usually is unplanned in India. So, pregnancy should be planned. So, if you are planning the pregnancy, folic acid supplementation is given, and after the conception these neural tube defects are very much reduced. Okay. Wide range of values are present in the community which can be the best measure of central tendency. Okay. Now, this is the question of a statistics. Central tendency. Central tendency has 3: mean, mode and median. Okay. This is standard deviation is a measure of dispersion. Measure of dispersion. Okay. So, it has been ruled out here. Okay. Now, between these mean, mode, median, what is the best measure of central tendency? If wide range of values are present. Okay. Wide range of values, for example, in India, let us take per capita income. Okay. Let us take per capita income. Okay. There are so many families, per capita income is 300, some families have 3 crores. So, there is a wide range. Okay. If you take a mean of that, so mean would be in the lakhs. Okay. These are very few, majority of them are in 40,000 to 50,000, but mean, if you take the mean, it will be in lakhs. Okay. For example, another example is there, you have a classroom. In the classroom, out of 100 marks, some students are having 15 marks, some students are having 95 marks, majority of students having 50 to 60 marks. Okay. So, when you take the mean, it might be 45 or 70. When there is a huge distribution, it might happen that mean is shifted because extreme values are there. For example, 3 crores are there, so mean should be between the lakhs, and per capita income, actual per capita income of the majority of population is in thousands. So, this 3 crores is actually affecting. So, if you take mean, what is the formula of mean? Sum of all the variables upon frequency. So, here this is not, if they are similar values, so it will be normal. Okay. In the mode, it is a repeated value, so it is not the good thing. Repeated value is there, so it is not the best part. Median, in the median you have to make the table as per the ascending order. In the ascending order, the middle term is taken. So, usually if you arrange in the is the very wide distribution of for example, a wide range of values are there. So, from the 0 to the crores, so in the between actual number is there. So, these high values, very wide range of values is not affected the median. Okay. So, answer should be median here if there is a wide range of values are there, and if the similar values are there, close values are there, so mean is the best option. Okay. Repeated values, mode, but if there is a wide range of values, for example, per capita income, class marks, so these are median is the best option. Okay. What people die in the dependency ratio will be. Okay. Now, talking about the dependency ratio. What is dependency ratio? Dependency ratio is how many persons are dependent. As per the government program, less than 14 years cannot work. So, less than 15 years and more than 65 years are retired, 65 years. Okay. So, those cannot work, and between the 15 to 65 our working population is there. Okay. So, dependency ratio is that those who are dependent and those who are earning. Okay. If old people die, for example, more than 65 people die, more people die here. So, this should be more than 65 should be decreased. So, dependency ratio would be decreased. Okay. That is good thing. If dependency ratio is decreased, so our population is not burdened. Less dependent people are there, more independent people are there. Okay, but they should not be there. That elderly people should also live long. But in the quiz scenario, that is old people die, dependency ratio will be decreased. Okay, less than 15 year and more than 65 year both decrease. Okay, so that is all about today's topics. So in the next series, in the next question, in next topic we will take, so that rest of your topic can be covered easily. These are very important topics which I have covered today. These are repeatedly asked in the your Fmge examination. You will get the question. I am sure that in the next examination these topics help you very well. Good evening.